Thank you, and I'd like to thank the committee for giving us the opportunity to share this data. I do want you now to shift gears entirely. This is a different way of thinking of disease processes, and so we're going to talk about vascular airless Downlo syndrome. I don't have any disclosures. So vascular airless Downlo syndrome is a rare disorder that we see in our clinics, and it is one of these ones that strikes fear into people when they see them. It's about 1 in 50,000 people, and to put it in perspective, vascular Downlo is one of 13 subtypes of Ehlers-Danlos syndrome, and accounts about 5% of Ehlers-Danlos syndromes that you'll see. This one specifically is due to a COL3A1 mutation, which is coded in type 3 collagen, which means that these patients have defective collagen in their arteries, in their bowels, so they have bowel ruptures, as well as the gravid uterus. And so we and others have published on this, and one of the challenges with studying this disease is exactly that it is rare. And most of the studies to date have been cross-sectional type design or retrospective reviews, and certainly there has been imaging limitations. We've certainly experienced that when you review multiple cases from different centers, you may not have the imaging to verify the diagnoses, meaning the dissections or the aneurysms that are described in these patients. So that's one concern, and the other concern is ascertainment bias, meaning the people that come to attention are those who have severe phenotypes, whereas those who have mild phenotypes, I would argue that we are operating on them and we just don't realize that they have this diagnosis. And the other component of this, it is a syndrome, meaning it has multiple systems. And so it is the patients are cared for by multiple specialties, and so it is like the idea of like the blind man feeling the elephant trying to describe it. And this has led us to decide as a group that to make progress in this research, we really do need a comprehensive knowledge of the natural history, that we need accurate detailed phenotype, and that patient input is highly relevant. And because of that, put in a grant for Patient-Centered Outcomes Research Institute to fund us for a study to build that infrastructure. And it had really 3 aims. One is the infrastructure, meaning we have an environment where patients, caregivers, and stakeholders can come together, where we form these relationships with the stakeholder groups, and also build capacity for patients as collaborators in research, so where we educate patients about the research process and how they can participate in research. So over the last year, I have happy to say that it was a very productive year where we put this funding to work and reached out to quite a few of the organizations. And so the landscape of the patient advocacy in this group has been where these multiple nonprofit organizations that were not working together and they're just in different locations, and these are usually driven by family members that have had loved ones who were affected with the disease, and because of that traumatic event or losing a loved one, they've created a nonprofit organization. So we brought everybody under the same umbrella and said, why don't we work on this vascular EDS collaborative? And so over the last year, that is what we have formed. And part of the work was to understand who's out there. So we sent out a 28-question survey between January and April of this year, looking at 4 domains: the diagnostic and clinical care history, experience related, the patient's experience related to vascular EDS, their information-seeking behavior, where were they getting their knowledge about the disease process, as well as their willingness to participate with researchers. This is something that's very important for PCORI, which is patient-centered outcomes research, is you want to get buy-in from the patient community that they're interested and invested in this as a process. So we reached out via substantial platforms of social media and patient advocacy websites, and including blogs by patients themselves who encouraged other people to participate in answering this survey. We initially thought that the survey should be limited to the United States, so we got quite a few responses, and you can see this is a map of the United States. The darker states had the higher responses, so we had quite a few from Florida, Texas, and California. But what was interesting is that it also attracted other countries outside the United States, such as Europe and South America and Australia, where people actually responded as well to the survey. So overall, we had 300 responses, and 76% of them responded on behalf of themselves, and the remainder responded on behalf of a loved one, whether they were a parent or a brother or a sibling. And 85% of them had had confirmatory genetic testing, so we know that it's not just clinical diagnosis, but they actually knew their genetic testing results. We asked them who takes care of them, and this slide, I'll have to unpack that for you. In blue, it shows you who are the providers that are seen by vascular Ehlers-Danlos syndrome patients. So most people have a primary care provider, and most of the providers, meaning the primary care providers, are available to them locally. But I was curious about how many people have seen vascular surgeons, and you can see that over 50% have seen a vascular surgeon at some point, but only 30% of them had a vascular surgeon available to them locally. And in terms of who organizes their care, this is in yellow. So you can see that, some patients have the primary care provider organizes their care, but 20% of them, nobody organizes their care, where they themselves were the care organizers, trying to keep all their providers informed of what is happening with them. We also wanted to know where they were getting their information. So most of the patients were diagnosed by geneticists, not by vascular surgeons. And then in terms of where they learned about their disease process, it was quite striking that most of the information came from the internet, not from physicians. And in fact, 67% of the information came from patient advocacy group and patient support groups. So a lot of social media work in terms of where patients are learning about their disease process. We also asked them what was most frustrating about their diagnoses, and the responses were actually somewhat interesting. Some we expected and some we didn't. This one we were not expecting. So one of the big concerns was that the emergency rooms did not know much about vascular EDS, where patients repeatedly told stories of presenting to their emergency room being dismissed because they tend to be young, and told that they're malingering, or that this is not really a real disease, or it is EDS, but it's not the EDS, that there's lack of knowledge about vascular EDS specifically that puts them at risk for strokes or ruptured aneurysms. The other thing is some people felt that they just couldn't find a knowledgeable doctor. One of the best stories is that every time they go in, and the first thing people do is want to bend their joints and look for bendy joints, when in fact, very few patients with vascular EDS have joint hypermobility. And so that was one of the things that was very frustrating for them. Other things that was frustrating is that there was no cure or treatment available, which is true, and then that they felt that there was not enough research that is happening for vascular EDS. When we asked them about who is willing to participate in research, 93% were willing to share their medical records. And it was also interesting, we also asked if we had a HIPAA-compliant portal, would they be willing to upload their records? And about 60% of those said yes, they're willing to actually personally go collect their records and upload their records for us. We asked them what was, in their opinion, the most important part or goal of vascular EDS research. And really, for this one, these are actually mutually exclusive categories, so we just had them pick one. And you can see that discovering effective treatment was about 40%, but educating care providers was important. A third of the people felt that education among healthcare providers was relevant to them. So in conclusion, there's really substantial frustration among the vascular EDS community about the lack of knowledge among physicians, and there's a high degree of interest in research. They're very, very invested in seeing better research be done in this field. And then this is really an opportunity also to discuss what's the best way to have the patients participate in research process, and then what are the methodologies that we need to do to build trust. So the people who said that they are not willing to share their records via a HIPAA-compliant portal, but they're willing to send things, for example, by snail mail, it was interesting to kind of explore that option with them. So what this has led to, this work so far, the grant has ended, and we're starting a new grant hopefully in the next couple of months. But what it has led is a commitment to creating a toll-free number. The toll-free number is designed for physicians, so it is a professional number, so that if somebody anywhere in the United States has a patient who has a vascular EDS and has questions, that they can be plugged in directly with people who understand the disease process. This is based on the model for neuroleptic malignant syndrome, which is a 1-800 number for anesthesiologists, neuroleptic malignant syndrome being rare. So that model is already in existence. So we are replicating that in work with the EDS Society. We also want to work on creating the education curriculum for the physicians. This is the work over the next year. And these are called fact sheets that will be developed in conjunction with the patients. And then the University of Washington, we have the natural history study where we are enrolling patients. This is in conjunction with international registries. So the registries allow the patients to input in their information and some basic parameters about them, and then they can say they want to be contacted further to enroll into a bigger natural history study. And then lastly, the methodology that we're learning is actually applicable to other rare diseases. Rare diseases have their own set of challenges, and so this has been a great journey in terms of learning of how to handle rare disease populations. And certainly we can extrapolate the methodology for other rare genetically triggered arterial conditions. It really takes a village. This is a tremendous amount of people that have come together to make this work happen over the last year. We've met amazing people around the country, and again, this couldn't have been done without PCORI funding, so I'm thankful to that, and thank you for your time, and happy to take your questions.
Well, thanks for bringing this condition to our attention. Who here has operated on a full-blown vascular EDS patient? it's pretty terrifying in most cases, and it's the one patient I'm afraid of, and you'll never forget it. So surgery is certainly not the answer. So this research hopefully will be useful.